Go.
Awesome.
So we have a lot of different questions and a lot of things going on. And as we set these workshops, obviously we were trying to anticipate. We also talked about it at our summer workshop about other things that you might want to find out more information about. Certainly, we didn't know then where we would be at this particular point, so it's even more timely that we would be having this conversation now. So Ms. Deanna is going to take over and she's going to go through a variety of different pieces of not just her job responsibilities and the things that she's. Oh, it's his.
Playing.
I'm going to mute. Oh, who is it?
It's the live stream playing in the background.
Oh, it is. You're right. I got to mute that. That's my fault. So thank you. I've done that before, but usually I'm not airplaying there. So as we go through this, certainly there's going to be a lot of COVID type things that align with that, but we also still have a strategic plan. We still have a lot of items that we need to continue to move forward with as a district. So while COVID is going to be a piece of this, certainly it's not her entire presentation. And so we're happy to answer questions as we go. My team is here because so many of the things that obviously go through HR, we all deal with and we all have different responsibilities for. So we'll be happy to kind of go through that and answer additional questions as we go. But I will let Ms. Deanna take over and we will go from there.
Okay, thanks. It's good to see you guys all in person. It's kind of an exciting night. Little things mean a lot these days, right? You'll see in a PowerPoint, and I'll sort of go through that with you. We'll start taking a look at what HR functions and supports are. Most of you know all of those things, but it just is nice to give you a reminder of the different things that we do. The list is long, but not any longer than anybody else's list. Obviously, personnel is the most obvious one, but you can see the other things that are underneath that we deal with every day. We move on to our CSIP and just update. As you know, we partner, Ann and I, Ms. Cook and I, on the Grandview 8 and 10 process. That is part of our CSIP and one of our goals in our CSIP. That's running very smoothly. We want to continue that. That's probably always going to be a goal because we want to make sure that our staff, we're paying attention to our staff quality of work life and benefits as well as salaries, and that's very important to have collaborative conversations with both the classified and the certified group. Most of you know about that process. I know there are a few new board members. I didn't know if you had any questions about those two processes. I know that you've both of the newer ones. I know you've already been through the summary of agreements process and approving that, so you may not have any. The other goals that we have in HR on our CSIP are diversity in recruiting and hiring. That and the next goal have been delayed. And I know that we don't want to use that as an excuse, but we are trying to move forward with the relationships that we started to build with our diversity in recruiting and hiring. We are developing a partnership with HBCU Lifestyle. They're going to work with us on some different avenues of recruiting and some training for our staff. But again, we have to be able to access that, and they're struggling somewhat right now to help with that. But we think that as soon as things move forward, that we'll solidify that partnership. We are using them to publicize our jobs. We'll be doing that more in the spring than we did last spring because, again, things kind of shut down last spring, and so there was some, not confusion. They were just trying to figure out how to enroll that and do that in a digital format. And I think they've done a pretty good job of it. So we're looking forward to what this winter and spring will look like. We're also investigating different companies that can work with us on developing a diversity training plan. I've been partnering somewhat with Lee Summit and some other schools because their as you may know, they have been looking at different programs as well. But specifically as far as recruiting, they are looking at some different programs, and we're also talking to independents and some other metro area districts that we're trying to find. There's a lot of things out there. We're trying to find the best bang for our buck, as well as something that we think is going to be effective and again available for training with our staff. So we're hoping to get that back on track this spring. Any questions about that? Those goals? I mean, that's a general overview. I know there's a lot to get to, so I don't want to belabor anything specifically, but certainly if you have questions, ask at any time, because this is more of an informal situation.
And one thing I'll add is just everything. I mean, I know she's going to talk about, COVID pieces and stuff like that. All of these, we're in a different world now than what we were obviously in March. And so I can tell you recruiting and hiring is it's going to be very difficult over the next months and in the next year because of the amount of people that are going to be coming out into education. May not be the same numbers that we saw before. Prior to this, we were already dealing with a teacher shortage of some regard, especially in certain subject areas. I think that's only going to get worse in this particular regard. But also, I think we will see increased retirements and other pieces of people getting out of education. So it's certainly, we don't necessarily know the extent. I just know the things that I'm reading and I'm going over nationally. These are the things that everyone's really concerned about and seeing what's really going to happen over the next 6 months and how this is going to change some of that. So even in some of my conversations with the staff members over the last couple of weeks, I got asked this specific question of, are you concerned about that? Absolutely. Are you concerned about retention? We've never had to worry about retention in this district. We have a higher retention rate than just about anybody in the area. And so this year, yeah, but I'm worried about it for everybody. I mean, just in education overall, not just specifically to Grandview. So I think all those things are going to be very interesting as we move forward, and we just don't have the answers to those right now.
Yeah, it's always, retention right now is really high on my list in the back of my mind. I will echo what Dr. Rodriguez said. There are going to be some challenges with that. And some of them are going to be COVID related. Some of them are just going to be an after effect of COVID and the atmospheres. People are going to perhaps be more ready to retire than they thought they were. So we're just trying to monitor that as best we can. As you know, we have a couple of dates that we look at for early notification incentive in the district. August 25th is one and January 25th is the other one. We did not have a lot of retirements this August, and so we will look at that again in January, and we usually get those, as you know, we get those to you at the January, depending on the date of the January board meeting, we get you those if it's before the 25th or after the 25th. So anyway, any questions about that? We'll move on then to all COVID all the time in HR. Just as an overview, what we're responsible for are the health and safety protocols, obviously compliance with the different governing bodies, making sure we're keeping good records and reporting out to the different agencies that we're required to report to. And I'll just make note that we report to the Jackson County Health Department. You'll see that in this is JCHD. And my team and I, which is really Mary Rhodes and me, she does the reporting to Jackson County Health Department. And in regard to OSHA reporting, we have not had to report yet to OSHA because we haven't had any positives from exposure in the workplace. We've had people quarantined because they've been exposed in the workplace, but none have resulted in positives. If someone results in a positive, then we have to make a notification to OSHA. So we are in better shape than some of our districts that have to do a little more of that than we do. So crossing our fingers that we stay that way. Any questions about that? You'll see, we'll get to a little more deeper as we go into the next slides.
Is your relationship with CDC new, or is that because COVID came into play?
Our relationship with CDC or Jackson County Health
I'm sorry,
Department?
Jackson County Health.
We've always had a relationship with them for different programs. It's clearly more intense right now than it typically has, and we hope it goes back to normal at some point. But we have had a relationship with them for different reasons in the past.
I know them by name. I never knew them by name before. I've been on more conversations with Frank White. I know Bridget, who runs the health department, Ray, who's one of the other doctors that's always on our calls with us, as well as Caleb, who's their attorney. So these are all the people that I know by name now that I never knew before. So we definitely have a more intimate, so to speak, relationship in that regard than we did prior to. And I'm with Miss Deanda. I just assume go back to the way it used to be in casual conversations, but we're not there for a while.
What type of things are they asking for you guys to report on? You know, obviously numbers and things, but what are some other things that they're looking for?
Yeah, we have to report all of anybody that's quarantined for any reason. So we have to report all of those, staff and students. We have to report birth dates, suspected exposure, or who the positive person was. We have to report all the close contacts. We have to give, I think she has to give contact information for them as well. And then they keep adding things. There's another new tweak that I have forgotten, but she has to add a button onto the bottom about whether they're put into a certain database or not. So whatever they ask us to do, we just add it, and we have developed the protocol for that. But we send hundreds and hundreds of emails to our contact to give them that information. But right now, that's the only data that they've asked for. At some point, it will probably expand because, as you know, you've approved the pods that we don't think about in a national disaster or national emergency. But who knew that this might be it? So at some point, those pods, and we're a site for that, we might be activated to distribute not give vaccines, but the vaccine to different agencies. So we're not there yet, but that could happen. Did I interrupt you? You started to.
No, you're okay. I was just thinking with some of the data they collect, because I've actually, it was been maybe over a month ago now that I had I guess a colleague who found out they were positive, but they didn't go through the whole process with the Jackson County Health Department. So like people that he might have been in contact with, there was no record, no one was contacted. So I'm just curious, just kind of thinking about how, depending on the system or the facility or the environment, maybe there's more stuff going on than it is out there where people are individually impacted. So just wondering what kind of what the reporting was, but you answered the question.
Yeah. So, and I'm not sure about that case, but typically wherever the person was tested, the testing company is the person is the entity that would be obliged to provide that information to whatever the governing health department would be.
And I can tell you from personal experience that if there is a potential exposure, the Jackson County Health Department calls you and tells you that, hey, you've been exposed and you need a quarantine.
Well, could you clarify, did you just say with the pods, we would just be distributing to agencies? We wouldn't be?
It'll depend on what they ask us to do, but typically it would be stored in, we would be the storage facility, and then we probably wouldn't even govern it. We would just be the storage facility. Now, obviously, you've probably read that there's certain temperature controls so we don't know how that would unfold. We just know that we have been designated as a site, and we've agreed to do that. So I wouldn't want to speculate on anything around it at this point, but if that was kind of where you were.
It could potentially be to anything. We could be just, they could be giving, but we wouldn't have hardly any control over.
I just
what it would
hadn't
be.
thought of it that way. I just assumed it meant that people would be coming here to get immunized. So I hadn't thought about that.
There's a lot of different ways it could unfold. So It's just hard to say. We could virtually just be a location that the National Guard came in and used. So, but we'll find that out when we come to it. Sure.
Can you give us an idea of where we're at on numbers, if any, of staff and students that
I think is it in there?
are going there, maybe?
Yeah, we'll get there in a little bit. And then you might want to switch to the dashboard when we get there. So that we can look at that. But yes, we've processed quite a few folks. So you'll see on your screen that those are the, I may be ahead.
Is that what you're doing?
Yep, sorry. A list of the staff and student health and safety protocols. You've probably seen all these already in your regular daily life, on TV, in your dreams, as I see them all the time. But it is your basic protocols, and then different things that we do have in the buildings as far as the temperature kiosks, how you're to map, how you're to list your contacts and so forth.
One thing that I will call your attention to that I think is very different, maybe not very different, but is different than a lot of people, is the third item on the left, picking a building map. We still map every single person that comes into our building. Every staff member, every single day, fills out a map and says where they've been in that building. I myself fill out a map every school that I go to, and I trace my location. And also you're supposed to put on there anybody that you had direct contact with in terms of within 6 feet for more than 15 cumulative minutes over a 24-hour period. So those are collected every night and stored there in the office for 30 days. And then as soon as something comes up, we ask for that to be when they do their contact tracing. So not every district has that as part of their protocols, but it's been something that we've had in ours since the summer. And we just never got rid of it because it's paid dividends for us in several different occasions. It took a little while for our staff to get on board with it and it be part of their routine, but I think that they're more in the routine of that now.
We're certainly getting there. We learn a lot when we have to go back to the building on a Sunday to get maps, and if they aren't there, and then to have to recreate those and so forth. So it's not perfect, but we continue to evolve, and it gets better. But it's, as the superintendent said, it certainly has paid off for us in keeping people safe.
Is that in addition to like any extracurricular, like say link programs, or is that just the staff that are there, like teachers and administration?
Link has their own protocol, and we have to depend on them to get that. We communicate directly with them. If we have any positives that also attended Link, we obviously there's not as much attendance at Link right now as there usually is, but we communicate with our management systems, our management teams in Sodexo as well. So our partners, we have a lot of intra-district communication or intra-agency communication. Was that your question, or?
Yeah, I was just wondering if Link staff is, going different rooms and whatnot, where they were using the maps and whatnot for you guys. So it sounds like they are. They may be, but you're.
And they're contained. We specifically went through the Link employees and mapped out where in each building they will be and which bathrooms and everything like that. So they're contained within a certain area, so we know what area that we're gonna need to if something were to come up, we would need.
Okay.
Yeah, they don't have free reign of the whole building.
No, not anymore.
Yeah, we just have to do that to make sure it's contained. So, and then we also have mapping on buses. We have seating charts on buses, and obviously we have video on some of the buses, so we can go back and look at that if we need to. We try to have that 6-foot distance from the drivers at least. It's impossible to have a 6-foot distance between all the students at all times. But we have the other mitigating factors, so we hope that helps us as well. Any questions about the health and safety protocols or anything else that you wanted to point out? The mask issue, You know, that has evolved as well, as you can imagine. Some people are religious about doing it, and some, you know, some of us have had to learn to be that way. We get feedback from our employees all the time about that. And we try to stay on top of that. As you can see, the different rules about wearing your mask. If you're alone in your space, you can have your mask off, but anytime anybody enters a space, even if they're more than 6 foot away, they have to put on their mask. And then in regard to talking on the phone, because there's a lot of projection that happens when you talk on the phone, and there's somebody close to you as well.
When you say you get feedback from the employees, can you give some examples about what kind of feedback? they're
Feedback
getting?
that other employees are not complying with what we've asked them to do. And so we send out reminders, which sometimes gives feedback from people that they don't need reminders, and yet their colleagues continue to come to us and say that they do. So we'll take that feedback and we'll just keep reminding them, keep letting them know. At some point, if we have frequent flyers that choose not to wear a mask, then we will look at other ways to reinforce their mask wearing in regard to job action and so forth. But
I
we,
didn't know if the feedback was about other employees or about students.
no, oh no. I've probably gotten a lot more feedback about adults in the environment not wearing their masks than kids.
Every superintendent that I've spoken to since school started said the same thing. Students, you gotta remind them every once in a while, but they're fine. It's the adults. And like she said, we get feedback around that being an issue. GNEA, in my meeting with them, shared the same concern with me, that they're still getting complaints and concerns from other staff members about fellow colleagues that are not following the health and safety guidelines. And I was pretty blunt with them during my meeting with them and said, this is a health and safety crisis. We are not going to play around with this anymore. They have been reminded several different times. And as she said, we will begin to do job action if someone is repeatedly not following the guidelines that we have more than 3 times shared with them and reminded them. Doesn't mean that if you walk out of your office and you forget your mask, because we all do that. You just forget, or I have to run back from the office and get my mask. But there are several that just walk around with their mask underneath their nose constantly. Like they just have no desire to have their mask on, and they're not following the rules and the guidelines. And we will not have a lot of patience for that any longer. And that gave a lot of confidence to them and made them feel better, because again, a lot of our staff members are very concerned, and as they should be, about their health and wellness while they're here. And these are the things that we continue to say are going to help keep them that way. We have not had spread within the schools, and it's because we have been fairly religious about all of these guidelines. And any breakdown in that is when we have challenges and concerns in some of the other school districts.
So we keep at it, and these are the things that are going to keep us all healthy and safe as much as possible, and keep our schools open. That's the message that we continue to send. Continuation of the health and safety protocols on the next page. What to do if you're symptomatic, who you report to. We have similar guidance that we've sent to parents, which I'm sure you've seen. If you're a parent with a student in the district and you've gotten those emails and notifications. Again, this is something that we've had to train our folks on doing, but people are pretty good at this. We have a few situations where people don't think and don't let us know ahead of time, and then but for the most part, people let us know pretty quickly when they're symptomatic. We have a lot more folks that are quarantined because of symptoms than we do because of positives or exposures. We're giving you and I know that that's hard to see if you have it in front of you. I get that it's hard to see because there's so much jammed into all of these flow charts. But you can see that this is the guidance. What you will see is this is the guidance that we're getting from Jackson County Health Department. That's based on CDC standards. And Mary and I, for every single case, go through this flow chart, and you will see that flow chart is for individuals that are symptomatic. Excuse me, and then on the next page, you'll see the flow chart if you're exposed to a positive case. And we go through that flow chart for every single case to determine how long a person has to be quarantined, if they have to be quarantined, if they test, does the date change? If they don't test, what changes? And there's a lot of little nuances in that, and we're getting pretty good at it, but Mary and I spend a lot of time emailing, texting, calling, and saying, oh, okay, here's a new one. How do we handle that? And we're in the middle of, most of them are pretty upfront, but we're in the middle of one right now where the person was symptomatic and then they had a child that tested positive. And does that change? Yes, it changes. No, it doesn't. And then when their quarantine was over, they had a second child that tested positive. And by the way, the parent was not positive. They had symptoms. They took a test. They were negative. So it would have been better if they'd been positive, because now with the second child, they're re-exposed. So now they have to either quarantine from their child, which is not always easy. If they're 14 or 16, it's easier than if they're 8 or, but that's 2 weeks then again from that exposure. And then all of the related Families First Coronavirus Response Act leave that goes with that, and when they run out of it, and when they can use PDO, and it's a whole lot of stuff. So, but this is the flow chart that we go through to determine what the quarantine will be, if there's going to be a quarantine, and we notify everybody involved what that is, what the time is, what leave they can use, how long the leave will be for, and then I communicate with Dr. King so she knows if there are teachers out, what has to be covered, and so forth. Any questions about decision-making in the flow charts? That's been updated a few times. They first issued that last, it was later spring, probably late spring, getting into the summer, and it's been updated at least 4 times since it was first issued, which is good. It gives us more information. So we continue to update that and continue to use that.
It hasn't gotten shorter.
It has not gotten shorter. It has not. Then we go on to compliance. You will see a list of what we do, the process that we go through, my team and I, and then the team expands from just Mary and I to some other people, as far as my admin assistants, the Sodexo folks, Mary reporting to the guardians, excuse me, and so forth. So this is a list of how we go through each one of these notifications, and what we have to. We don't go through every single one of these, but we go through these depending on what is actually related to the specific case. Just to give you an idea of how that communication goes when it comes to my office. And then Mary and I work with the administrators or site level folks to do the contact tracing, referencing back to the maps and the people listed on the maps. Sometimes the maps are not necessarily accurate, so we have to go back and ask questions of the people. And then we get feedback from other staff members, maybe in a building, that have heard somebody was positive or exposed, and they want to know why they're not being sent home. And so we don't have to, but we do take the time to, explain to them why they aren't being sent home, that they weren't a close contact. This is what constitutes a close contact. We get quite a bit of, and people are getting a little bit better about this as well, but I have a cousin who has a cousin who's positive, and I saw them 3 weeks ago, and then my baby brother saw them, but I haven't seen anyway. So explaining to them why they are or are not close contacts. If someone in your building is positive, it doesn't mean the whole building gets shut down, which is the good thing. That helps us with classrooms as well. So if we have kids that are positive, We may have 0 people that have to go home. We may have just a couple of kids that have to go home. And our hope is that we don't have to shut down a whole classroom. So that we can sort of, this is probably not the right word, but it's kind of surgically move that group of people. The good news is that so far, any close contacts that we have had student-wise haven't infected other kids that have had to be quarantined. We haven't had a lot of that, but we have had some. So,
When you say there's inaccuracies on maps, can you give an example of what you mean by that?
like I might get a map that has, and maps also have a list of names that are supposed to be close contacts, and close contact definition is within 6 feet for 15 minutes cumulatively within a 24-hour period. So sometimes I get maps scanned and sent to me, and there's a list of 27 people on the map, and that's all it says. Sometimes I get maps that have 6 people on it, and next to it, it says 3 feet, 6 feet, 2 feet. So we have to go back and say, help me understand, were you really within 6 feet of 27 people during the day? Because if you were, I'm not sure what's happening. Oh no, I just saw those people. I waved, they were in the cafeteria when we were doing PD. So that's part of the training, please just list people that meet this criteria. 3 feet, 6 feet, what did that mean to me, to you? Well, I was within 3 feet when I passed them in the hallway. So,
15 minutes. Yeah.
right, so we have to investigate some of that. And sometimes they're really a diagram. The maps are actual maps of the building, and you're supposed to put arrows or X's where you were. Sometimes I've gotten maps that are studies in art, because we've got arrows and waves and and people are busy, so some people are busier than others, and so I have to say, okay, were you here? It looks like maybe no, I thought about going there, and then I stopped, and then I so it's just some of that. People are getting better at that as far as that goes. So, my map, I've adjusted, I've learned from all that. So I do my maps electronically, and they're in a shared folder. So anybody in my department, if we got sick, they could just go get the maps. But I have like a giant X that I put on where I am and so forth. So just so there's no question about where to go. So does that help?
Yeah, it sounds like maybe it's more of people being more overly cautious than not actually saying where they went. So
Yes,
that makes me
sometimes.
feel good.
Yeah. So anyway, and that's our job. That's what we'll do. So, and we get principals to help us with that too. So that is helpful. Or give somebody a call at home because they forgot, or they did it, but we can't find it, and things like that. So.
One thing that we've added to this through conversations with, again, GNEA, MSTA, and feedback that we receive is just, trying to be as transparent as possible. And we asked about adding a letter that we would send out that would include staff and parents when there's a positive case. And so we came up with a template. Ms. Deanda kind of had this, and we got some feedback around other HR departments, and she kind of created one. We got feedback from MSTA, GNEA, and our principals, and we created that. And so
And it went out tonight.
one of them did.
I got it.
It helps.
And I appreciate it.
I mean, I think some people, it helps. For others, it causes more angst, or then we get 15 questions of, well, you should be telling me who, and I should know. And so, I mean, I think there's a balance there, but I think mostly the feedback has been positive in that regard, but especially from our staff, because I think the goal is, again, to try to be as transparent as possible with that. But that definitely is something that's, again, as we evolve, that we've changed in our practice even over the course of the last 2 weeks.
I think unfortunately, you can't have both sides of the coin, right? Somebody's going to be upset no matter what you do, but erring on the side of transparency is appreciated. Whether that, causes people to have more anxiety about the situation, that's unfortunate, but, I thought the letter was really nice.
We would at least like to control as much of the narrative as possible. So if someone's saying, I heard this, whatever like that, at least they know for sure. this did happen. You should not have to worry about it. You've already been notified if you need to be. It may cause more angst, as you said, but at least we're controlling that story.
And I think the more we send those letters out, the less negative response, or not negative response, worry,
Mhm.
the less fear people will have, because they understand that, we're making sure making sure you're notified, trying to make sure everybody's safe. So. Any questions about that part of the process and how that looks?
I just noticed, it talks about reactive cleaning.
Yes.
The machines that were purchased to clean the rooms, how often is that done, and is it reactive or is it done proactive?
That's just the name of it, is reactive cleaning.
Okay.
I don't know how it got that name, Miss Cook.
Well-
We are reacting, but
It's both. We are, when there has been a positive case, Ms. Deanna contacts, Ms. Brantley and Mr. Barry with facilities and kind of lets them know where they need to go, and they get the maps, et cetera. And they do use the machines in a room if there has been a positive case or even an exposure that we're concerned about. But in addition to that, they are doing it on a proactive basis. They have one at the high school pretty much all the time and one at High Grove pretty much all the time. Then the other two, they are rotating them throughout to other buildings just to go through, and they make sure they do some of the common areas, the gyms, locker rooms, places that are real germy. And then just any rooms that the principal feels beyond that they might want them to hit on. But then if something happened at one school where we had a large area, several areas where someone was, they're mobile, so they can put them in the van and move them on over and go to town on that one building.
So for right now, so you're saying like, if there's a positive case or there's some symptoms that you're concerned about, then you bring the machine out, but on a normal basis, like I know we just added, the elementary schools back, on a normal basis, we don't use those machines. There's a different method of cleaning, I take it.
Well, that's just using the UV. They are doing, during the day, they are disinfecting touch points throughout the whole day. And then in the evening, the custodians are using a cleaner and disinfectant throughout the entire school. So that is occurring. That is just another level of another option to assist with the cleaning. In the area of a positive case, the nice thing with this is that once they use the UV light machine, the crew can go in and clean that room immediately. Otherwise, they would have to wait a 24-hour period before they could go into that area and do a complete cleaning and disinfecting.
Yeah, so the machines are primarily really for the positive cases that we get. Is that what I'm understanding? Or am I missing?
positive and symptomatic.
Symptomatic.
Mhm.
But we are using it on a proactive basis just to,
Okay.
Yeah, the other proactive piece of that, I would say, is, we've never had teachers ever be responsible for some of that as well. So as they have spray bottles and we've taught them and they spray down surfaces as well throughout the day. So again, trying to balance both of those, constantly trying to be as proactive as possible, but some of this absolutely is reactive, but it's not only reacting to positive cases, as any potential quarantines, that is still, in my opinion, proactive, because it's not a positive case. Positive case is a 100% reactive, and this is an additional measure that we didn't used to have access to.
Good question. Moving on, as far as compliance, we are in the process of, as you may or may not be aware, these Binex Now antigen tests were made available for school districts all across the state of Missouri. We did apply and are participating in that program. It's taken, there's a process for us. We actually have them in hand. We had to develop a place that we would go ahead and administer the test that would be isolated, and so that people that are symptomatic could come in, get tested, and not expose anybody else. And we have found a site at the high school that we believe fits that bill, and people can enter from an outside door, go directly into this space, get their test, and then leave. We get results within 15 minutes. Our three district RNs are the only people that are allowed to administer that test, and they had to go through quite a lot of training to do that. And we have developed a system around that of permission, releases, and release of information to the person. We hope that's going to help us with our staff, and right now we're just going to be using it with our staff, not students yet. But symptomatic staff, again, that's the lion's share of our quarantines at this time. But symptomatic staff, especially during a time of year where colds and sinus infections and strep throat and all of those things are going around, that all have very similar symptoms to COVID, that we can hopefully eliminate some of that. Even if they got a negative test, we would want them to stay home until their symptoms subsided, but they could get back a lot quicker than the 10 days that they might have to stay. We have been in a queue to be trained on the reporting process as well, because part of this is reporting to the state, and we just got into that queue for the training today. Or this week, and we are hoping to get that finished. We'll probably do some pilot tests of some staff later this week before we move it out to and make it available to everybody. And we'll let our principals know once that piloting has been completed, and we think we're ready to go. We think by the latest we'll be able to do this full force when we get back from Thanksgiving, but we may start doing a few in that pilot even this week and a couple of days next week. So we are really pleased about that and hope that that helps us with staffing and giving peace of mind to employees as well.
You say you're only gonna test symptomatic people?
Right.
So what kind of supply do you have on?
What kind of supply?
Like,
How many kids?
How many kids do you have?
Yeah, right now, the test kits that we have are, I think we have less than 500. Do you know, Kathy?
I do not know.
It's around there, but when we placed our order, we were allowed to place an order for every student and staff member that we had. So it didn't mean that we had to test everybody, whatever, but we were able to order that much. So in our plan, we actually had plans to potentially do students as well, but that was not ever our phase one kind of approach, that we were just going to approach that with our staff. But it's specifically designed for that, for us to be able to use it with symptomatic staff.
So we can get up to 5,000, which is what we applied to get. I think our initial is 500, but I can get that specific if you need it and get it back to you.
Is
Yeah.
there a fee for the teachers at all?
No,
These were all provided for free for us.
And as far as this.
although now that you say that, no.
As far as the symptoms, you know, me who has allergies, I know what a symptom is for my allergy, but is it a situation where another teacher says, hey, I think she has symptoms? I mean, I'm just trying to think, at what point do you kind of, yeah. I mean,
Yeah, it's the employee has to report the symptoms, and some
so the
employee,
employee does.
the employee does. Yeah. We don't have a system that we have people that are reporting other people at this time. I'm sure we would listen to that if somebody.
Yeah, I was gonna say, like the feedback you got with the masks, right? If you get that, will you make that person get tested?
If they didn't
Well, I
wear,
guess you can't make them, but.
if they didn't wear their mask,
Well,
yeah.
no, not the mask, like she was
Somebody
asking.
said they had symptoms.
Yeah, somebody else said they had
Well-
something, you know, Joe Blow in the classroom next to me, he's coughing and hacking.
We would probably use our healthcare professionals in the buildings to investigate that. And then help us make a determination about that. To be clear, we can't force anybody to take a test, even though we're their employers. But we can force them to quarantine because we are required to well, you've seen it all today. So yes and no.
So again, from personal experience, the only way to force someone to take a test is if you have to test everyone. You have to say it's a blanket. So I had to do that at work, but they said everyone must take a test to condition of employment. but they couldn't just pick and choose, right? So that's part of the CARES rules, is that if you test one and you're forcing it, you have to test everyone.
That's a good point, so.
So if somebody's just coughing and hacking and they think, well, I don't know, is it cold or is it whatever, but I don't feel bad, and they get tested and it's negative,
Mhm.
then it's a kind of a, and maybe a couple days, or it's kind of a judgment call, probably.
If they're just, well, and coughing, just a cough alone is a symptom that we can require you to quarantine. But like you said, there are people that have coughs for all kinds of different reasons. You know, I'm sure that people in this room tonight have coughed different times, even me, including me. That level of cough isn't going to get me quarantined, but, that is, right. That is one of the big symptoms though, that we will pay attention to, so.
So you mentioned pilot.
Mhm.
I mean, what do you expect from the pilot?
Just process.
Okay.
Just process. We want to make sure that our process is firmed up. We know what we're doing. We have a good flow. We find out if something that we had planned within the process wasn't a good idea, didn't work, needs to be adjusted, so that when we do it at a larger volume level, that it will be more efficient. All of these tests have to be done by appointment. You will be sent home anyway. I suppose there could be some cases, especially because it's at the high school. So I'm guessing there may be a case or two that we would isolate them right there at the high school, get them in there and get them tested. But it would still be, it's always by appointment. Somebody just can't drop in and say, hey, I'm on my planning period for Meadowmere, and walk in the front door, and then 7 people have been exposed and you think you have symptoms. So we want to be able to control that environment to minimize the exposure to everybody. The nurses have a whole protocol of PPE, and you've probably seen pictures of similar things on the nightly news in hospitals and so forth. So they have to get, the PPE on, get the testing environment at the appropriate temperature and with the appropriate reagents, and go from there.
So it says onboarding of staff is in process now. Was there additional staff that had to be hired?
No, our onboarding of by the state system. The state system had to onboard our healthcare staff into their system. That's a good question. It's not clear.
How are you guys on supply of PPE? I ask because my company sells it and we're in an extreme shortage right now. So it's a bad deal for PPE. So are you good? Like you have
Right now, we're good. I don't know if Ms. Cook wants to speak to that at all. From what we've ordered, right now we're okay, but we're concerned about when it gets bad again, of course.
order ahead.
We've
Right.
had a
Or
lot,
more now.
but we did that
Right.
so many different times throughout the summer and into the beginning of the school year. And we kept ordering different times between Angela, between Adam and transportation. And we had several pockets of groups that were doing that. So I still feel like we're in pretty good shape right now, but it was because our directors and our assistant soups were pretty proactive in making sure that we continued to stockpile, so to speak,
Good.
anticipating that it was going to be needed throughout. So I think those are still ongoing pieces, but also we've got some FEMA relief, certainly FEMA gave masks. I mean, so every time anybody was offering anything, we've just accepted it, and we keep storing it. So that way, in case we ever need additional ones, we have them.
We're going through them.
Yes, we are.
Yeah.
Who's using it? I mean, like, everybody looks like they got probably custom masks here, but what does your stockpile consist of? What type of things are in it, and who uses it right now?
I mean, predominantly for PPE, for the masks, we have adults down to kids, down to we little ones. And because even though we've told parents that your kiddo needs to come to school with a mask, there are a number of kiddos that get on a bus that don't have a mask, and so the bus driver will give them a mask. So we've gone through quite a few. That's probably the biggest
Mhm.
thing we've that we've
Sanitizer.
had and that we go through, and then obviously our our, the disinfectant we have, Angela Brantley ordered 55-gallon drums of the Oxivir, which is what we've given to, all the teachers and stuff, because that's the stuff that you don't have to wipe down. It's got less than a 1 minute or less dwell time, so it's pretty fast acting and very effective. So she's kept it going, and, Ms. Brantley actually got to know quite a few people in their supply chain because she was, no, I need to talk to your boss because I'm supposed to have this stuff and I need it, and so she's worked hard for us in that regard.
She has. Now, and certainly, we know that most kids leave their home with a mask. We really believe that, but you know that it doesn't always get to school, it doesn't always get to the bus, it might be on the ground somewhere, or they can't find it, so parents are doing a great job supplying kids masks and getting masks to school. It's just like gloves and books and pencils, it doesn't always make it, so.
Or stay with them. If you
Or
look at the lost and found piles at the end of the school year, how many gloves and hats and
We
coats
will
there are.
not, we will not have masks in the lost and found.
We will
That,
not
those
be
will
keeping-
all be going in the trash or any other PPE, but yes, you're exactly right about that.
We've had to replace, like kindergartners just slobber on it in good sweat until we replace them. I mean,
Yeah.
We do go through the lower grades a lot.
I believe that.
Yep, or stick their pencil through it, or hopefully it's not on their face when they do it, but yeah. Stuff
That
like that.
happened one time with me.
Well, I'm sorry. Nobody in this room, for sure. Any questions about the testing?
Did you snort? You totally snorted.
It's always our goal
It's our goal, by
to
the
get
way.
one snort through the afternoon, the evening. Any questions about the testing program? We would let you know if we start to expand it to students. Right now, that's not part of this first plan rollout, so.
I got you on the next one, sorry.
Thank you. Just quickly, related records, we have a giant spreadsheet and our superintendent's in the middle of making it a Cadillac, which we need all the help we can get. As we are processing this, capturing this data, using this data to update the dashboard. This might be, Kenny, I don't know if you can, and I included the link in there for those of you, but you can see that this is our dashboard. I know that you've been notified about this, but it's updated every Wednesday. As data changes, we have then updated it from the first week in September that we started capturing it, if we needed to add more information. Just like everything else in regard to COVID, that has evolved and the data we collect has evolved. So we've updated that as we move along. Again, we do that every Wednesday. The data we collect goes from Wednesday to the following Tuesday, and then we post it on Wednesday. Any questions? I'm sure you guys have all seen this, but sometimes there are questions around that. And then just quick data that I included there about our positivity rate within the district. If you look at the positivity rate with employees and students, we're at about 2.9, or excuse me, of staff, we're at about 2.9% of our total staff, which right now we're at 605 FTE. But if you look at it as a percentage of our quarantined folks, we're at 7.3, which we feel we're pleased with that. We'd like that to be under 5%, but we're glad it's under 10%. And we're certainly glad that it's under 3% for the total staff. You know, I don't think we're under any illusions that that's not going to go up, given what we're seeing in the metro area, given that we're going into the winter season and with everything else going on. Grandview's not going to be immune to what's happening, but we hope that we're mitigating that in every way that we can to keep our staff and students safe.
How does it compare to area districts?
So 3% is about normal, but what I can say is most of them are doing it like an immediate. So like when I talked to superintendents last week, they were talking about that currently they had about 3% of their staff that were out. So everybody is kind of measuring it a little bit differently. You know, we're kind of measuring it, we look at it by month, but then certainly this is since July 1. You heard about, was it Oak Park in North Kansas City, I think, or was it, I can't remember which school, but they just closed another school in North Kansas City
Staley.
where they had Staley, that's right. They had 27 staff and students test, which is about 1% of their entire population in that building. So everyone's measuring it a little bit differently, but on any given day, they're saying about 3% of their staff are out for quarantine versus the other. Everyone's saying the same thing. Their positivity rate generally, besides that, you know, with one or two exceptions, is pretty low. And it's the quarantine piece that's a lot higher. Even at Staley, most of those cases were not spread within the school though. Those were positive cases that they had and people were coming into the school, but there wasn't a spread within that school that caused that. So that's still a good thing as well. The quarantine side continues to still be a concern, obviously, because it still means staff members are out. We do hope that the testing may help us a little bit with that, but we're not necessarily sure if that will or won't. The other side that I've talked to principals about and made pretty public with the staff as well is just making sure that we don't make things worse on ourselves. We've had examples of people that meet with other people, they think that they're fine, they end up testing positive, and then when they contact trace, we just lost 5 teachers in one building because they decided to meet for lunch in their classroom, or they just had a meeting or a PLC or something, and they just happened to be 2 or 3 feet away from each other when they had a whole room that they could have still distanced themselves, and then we wouldn't have had that issue. So we're still having some of those concerns as well, and so we're trying to make sure that we encourage as strongly as possible that, you know, you need to make sure that you are following all of these guidelines, because we can't lose staff members to quarantines just over something that you can control. And so I think if we start seeing more of those, we'll do some different things in terms of requiring every meeting to be virtual or different things like that, that we'll try to prevent that. I think it'll be okay in that regard, but the quarantine side is certainly the biggest concern that we have, because it, as you know, this is the time of year. So every symptom, and it's a lot of symptoms that we have this time of year that all are on that list. So it definitely makes it a little bit more difficult. So everyone's having the same challenge. It's staffing. No one's seeing spread within the schools, but staffing continues to be the concern. Blue Springs and a couple other ones, the reason why they shutting down after Thanksgiving at the secondary level doesn't have to do with the spread. It has to do with their concerns over staffing.
So that's what I was gonna ask about. I saw that article today. The school district is closing down because last week they could only get 73%, this week 53% of their substitutes. Are we having the same problem with regards to subs with quarantine?
Yes. Ours is generally, I would say, a little better than some. I mean, some of the worst ones that I've seen have been like really, really bad, but I can tell you on any given day, ours are just as bad.
So how are we managing that? Just combining classrooms?
A little bit of everything.
I was gonna say, all kinds
It's
of
a
ways.
massive system of me maneuvering, figuring out who's gonna be able to cover with the building principal, as far as a para, who has the para support. The middle school, we had a huge issue with the middle school. We had several quarantined, and it was a team of teachers out. And that was a matter of who was on a planned time, that had the same grade, that had the same subject matter. Could I get them to cover the class? In class, the teachers were all asymptomatic, so they zoomed from home with the kids. I mean, it was this massive maneuvering to try, and we're paying them sub pay for whatever they do. It's outside of their time, but it's taxing, and it's troubling for the teachers. That their morale is already, they're feeling like they're working really, really hard, and then we put this on them as well. So it is something we don't want to do. But we have like repurposed librarians, and repurposed reading specialists. I've repurposed anybody that I possibly could in different situations.
I know my son said one day, one of the APs was
Yeah,
doing
we've
his
had
class.
building principals have covered classes, so yeah.
Do you know, I know the original PSRS waiver is December 30th. Do you know if they're talking about extending extending that?
They're talking about it, but we've got nothing specific from them
We,
yet.
several superintendents, myself included, our HR department, several areas sent in letters of support to encourage and to try to allow for that. So we're hoping that that's going to be the case and it's going to be extended, but that's we have not heard for sure.
And the extended alternative certification as well.
Yes.
Both of those are really important right now to continue to get subs. But you have to remember that our subs are being quarantined too and can't work.
Yep.
And they're fearful and not working and so forth. So the unemployment benefits ended long ago for some of these folks. So they're not just staying home to do that as far as our sub pool. So it's all kinds, it's quite an approach. So anyway, and I don't know about you guys, but I have at least one symptom a day that I'm worried about at some time or another, whether, I'm going to be getting sick. So it usually goes away and I've forgotten about it, but, at least once a day. Okay. So just a quick schematic of reporting and how we do that. As I said, Mary reports the student and staff information to the health department, and I'm the one that reports it to OSHA. You see the OSHA guidelines below. And as you can imagine, if we ever have to report it, it's quite an extensive system to do that. So I'm just knocking on wood that we don't have to do that. Any questions about reporting? And other than that, I think my portion of this has come to an end, except for any additional questions that you may have for me. And you certainly all know my email address, that you can always send an email and ask any questions that you need to, unless you want that to go directly through Kathy. I'm sorry, I probably. Maybe copy Kathy if you're sending it to me.
The common themes that you've heard, I mean, obviously tonight, some of the common things, that I've heard over the last couple of weeks, and I'll report on some of this on Thursday night as well. Certainly this week, bringing back, pre-K through 2, 4 days a week, certainly got a little bit of feedback around there. I will tell you, most of the teachers that I have spoken to, when they tell me about their families and the parents that they're speaking to, most of them have spoken very positively about their kids being able to come back 4 days a week. Certainly there was a lot of angst with our staff, and I tried to alleviate that as best I could in talking about why we did what we did and still moving forward with it. I provided that to the board as well. Again, the 0 to 9 age group versus the 10 to 19 age group in terms of cases is dramatically different. So there's still a pretty low case average for 0 to 9-year-olds versus 10 to 18. Once you go to 10 to 18, it almost quadruples and then moves up in that particular regard. So we still felt really good about that, but also we track the numbers as well. I mean, one of the first things that we started talking about when we were looking at all the grade levels was how many students that is. And I think we're averaging what at our K through 2.
Total for their,
Yeah, but what's our average or so for the classrooms and that?
17 to 18 students per classroom at the lower
Is
level.
the average, so it's the highest.
Well, no, sorry, 18 is the highest and the lowest is 12, so the average is like 15, 16, but they're not all showing up at the same as well either. So far, I'll try to get feedback from the building principals for the first 2 days, how it's gone. And I will say I'm getting honest feedback from them, and I appreciate that, is 2 of them said social distancing kindergartners is much harder with 17 children than it was with 6 or 7, and which totally makes sense. And they're feeling like this is gonna take me a little while to get back used to having this many children again, in class. We have had three families, 3 children, it ends up being 3 children that have requested to go virtual due to the fact that we brought so many kids back. They're not comfortable with it, which that happened today, and that's fine. I mean, we'll go ahead and, do that. We'll honor that. We always said we would go back. We would let them go virtual if they needed to. I'll get more feedback on it, but I thought that was good. The angst of keeping them separated, and they're also moving them together in very much in pods, like very cohorting their classes. And kids don't, it's like cohorting kids, they're not gonna stick together and and so it's a constant thing of getting them in there, so keeping them together in those pods, so it'll be interesting.
Obviously, what complicated things was, Mayor Lucas coming out, which, I totally understood, his position, and I don't blame him at all for what, he changed, but anytime somebody comes out and says something, unless they specifically say something about schools, everyone starts asking the same questions of, well, he just said you can't have more than 10 people, so why are you guys still in school? Well, his guidance doesn't pertain to schools. He specifically, when he talks to schools, he will say schools. And so as we continue to have our protocols in place and the things that we do, he is not referring to schools in that particular regard, and Jackson County will be the same way. Now, that certainly might change. And so we will modify things as we need to, but it's very possible that I put something out to our community within the next 24 hours that just lets them know, this additional guidance doesn't pertain to our schools. We will continue to operate, but we will continue to also talk to Jackson County Health every single week and regular communication with Mayor Lucas's office and the things. And as that guidance changes, we will adjust as we need to. The number one concern for us right now is really winter sports. We'll see what happens with winter sports. There's a lot of conversations around that. I hope to have more information for you on Thursday. It's entirely possible that I'll have an update then. Right now, we're planning on moving forward with winter sports, but anything can change, as you've seen, as soon as one additional report comes out, and we have to review that, and we have to make sure that we're ready for what that means, and it could mean shutting things down. So we'll just have to wait and see. But overall, still feel good about where we are as a district with all these things in place. But this is a constantly revolving, moving target in that regard, especially with our staffing, and it's still a major concern for us right now. So going into Thanksgiving, we'll just have to wait and kind of see what's going to happen on the backside of that, and a lot of days even between. It's only a week before we're done, and we will live about a month and a half in that week. So we'll wait and see what happens from there. Any additional questions? Like I said, I know it's a lot of information, but I felt like it was timely. I also felt like it was something that you would want to know and need to know, maybe more than you needed to know, but I can tell you, I am in awe at times of the amount of work that Miss Deanda and Mary Rhodes have to do on a daily basis. And this does not stop with 5 o'clock. This does not stop with Friday. I can tell you, we get text messages all weekend about what's going on and additional staff members and stuff like that, because then that puts different plans in place. It could be bus drivers, which is a major concern right now. It could be bus parents, it could be some of those concerns, or us shifting additional classrooms and things like that. So this happens all the time, all night, into the weekends and things like that. So this is something that's going to be an ongoing thing for us for a while, and we'll just have to evolve with it as we need to. Additional recommendations as we have them. Like I said, if it forces us to shut down a grade level or a building or whatever like that, obviously you will know before the masses do. We will just kind of evolve with that as needed. But it's a lot of stuff and it's a lot of work, but I'm very proud of the work that group has done. And it is definitely massive, but they have done an amazing job of putting all those things together and evolving with that protocol. So we feel like we're in good hands, but certainly it's a lot.
How has the high school done? I know we've brought back about 200-ish.
Yeah, it's been really good. What was mentioned today, I've been there several times, and obviously when you have about 105 or 110 kids there on any given 2 days, and you're used to 1,100 to 1,200, it's quiet. So that's the number one word that we were kind of using today, and Mary Rhodes actually was who made that comment today. Is it's just quiet. Now it's good to have those kids there. Don't get me wrong. The kids that are there are benefiting greatly from being there, and the teachers that I've spoken to, again, everyone is still concerned and everyone still has some safety things, but most of them have been like, man, it's just so good to see kids again. And it's a very small group, so it's been going very, very well.
They've
They-
been following the one ways and the. I was
Yeah,
so
I
happy
was
the other day, and I
over,
thought,
I was over at the
"Oh,
high school and my kid came out and I was going the wrong way and they informed me that I was going the
going the
wrong
wrong
way.
way." Is there a plan to bring additional students?
There is. I don't know right now what I can do and what I can't do in terms of that, based on the guidance that we have. We do still have such a small amount of kids, so it's still possible. But I think, we kind of paused things for the moment, and, but we're reviewing that next wave of plans, because that was our goal, is to start slowly bringing back a little bit at a time. But I also know, there's a lot of perceptions there too of is this the right time for us to be doing that or not? So, considering staff and considering everybody else, my hope is still to do that. I have told kids that I'm talking to that that's my goal. I'm trying, but at the same time, it's kind of, we're not sure yet.
So what made you choose these 200? What was the factor?
I mean,
Yeah,
they have 5 or more apps,
Okay.
they have 5 apps.
Do you know what the number or percentages of students currently in that were, how many have outstanding that still need to come back that were virtual, based on how many you let come back?
I'm sorry,
say that again.
the question?
So there was a number of children that were gonna be virtual.
Correct.
right? And now you already have some in. What is the remaining number, since you've already let some come in? Is it 20%?
Yeah,
50%?
So you've got, about 1,100 kids, but about 40-something% of them had automatically chose virtual for the entire semester. So you're already at about 600, 650, in that particular regard, that would be left. So this would represent a very small amount, obviously, of even that group. So you're talking about maybe 650 to 700 kids total that could come back if we brought everybody back today. Was that your question?
You're sure that's how many is remaining outstanding?
We would still have probably an additional 450 or so, I would say 400.
Yes, yes.
Okay.
Have we already started, or are we going to start the process of offering options for next semester?
Yes, we actually have had that conversation, and we were going to have that survey go out this week or beginning of next week, and we decided to delay it till just after Thanksgiving, just due to the timeliness of where we're at.
That's
So
a good idea.
we're going to put that survey out on Monday the 30th, and it'll be a little bit different than it was before, but certainly the same basic premise of choosing what you're going to, what mode of delivery for second semester.
So is it safe to assume, based on the current situation, that you will not be bringing back any more students for the full 4 days before the end of this semester?
I do not have any plans to do that right now.
That's what I figured.
And I don't, and honestly, when we think about the elementary buildings, like the rooms have to, for K2 have the biggest, we had to move some people around. I mean, we've done lots of things we can do, and quite frankly, like Martin City has got some 5th grade classrooms, and they're very small, we just couldn't, we'd have to think things completely differently if we were to start moving in that direction. So at this point, we can't, with the physical space we have in a lot of those buildings. So,
We also have a little bit of extra time because our second semester doesn't start until the 3rd week of January. I think the semester ends on January 20th, which is very different than what we've had before. So again, it feels like we're almost at the end of the semester, and we actually have a little ways to go. So we thought that we could push that date back just a little bit, and so we'll release that for the 30th. But any other questions?
Yeah, Roy, are you sleeping at all?
Trying to,
Yeah.
yep, trying to.
Just looking at all this stuff, you had to do the flow charts and all that, and thinking, are you sleeping? Are you doing anything else other than this? So-
Mary and I text each other and say, go to bed, get some
Yeah.
rest.
Well, I'm glad you have each other to remind
Yes.
you.
I don't have a question, but I do have a comment I'd like to share. Sorry, I didn't mean to startle you. I just wanted to say thank you for all that you're doing, because I know these are trying times, and to hear all of this information, how you're taking care of the staff and the students is absolutely amazing. The level of work and the level of detail that goes in daily. So thank you. We appreciate you. And yeah, get some rest, please.
Thank you.
I will say that same thing just for all of you, not that you need me to say that, but I try not to say this very much in front of my teachers because I know they're working extremely hard and they're stressed and everything like that. But I worry very, very much about the 3 people that you see before you. They are working more and harder than they ever have. These are encompassing. It does not stop with the weekend. We talk to each other and text each other all weekend. I try to stop at times to make sure that they're not expecting me, or because when I text them questions, I know they feel like they need to respond immediately. So I have to be very careful, but I know they're working a lot of the weekends and trying to just get through because there's just so much. And I'm not kidding when I say each week does feel like a month or 2 months in terms of what we have to go through. But this is where we are. And, the team is strong. We are going to get through it. And, we try to over communicate with each other. We are a family, so we bicker like family members, and but we love each other like family members as well. And so they work extremely hard for everything that you just said, sir. They do it because they know that our staff and our students rely on us in order to do that. So publicly, I will thank them for the work that they do, because it is a lot. And I know that every time I ask one more thing, I know it's one more thing, but they also know that this is the job and this is what we have to do. And so I always appreciate their efforts, and they're doing an amazing job considering that there is no manual for this. There's no playbook. We're just making it up as we go with the best information that we have. And then we come back tomorrow and we do it all over again and change everything that we knew yesterday because we have new information. So it's very much like that. You're building the house while it's on fire and you're in the middle of a meteor shower. So you're just trying to figure out kind of the way things are going. But I could not, this district would not be where it is right now, which I think is in a very good spot when I speak to some of my colleagues without the 3 of these individuals in front of you. So. That's all for me, sir.
All right. Well, I appreciate you sharing. Any other questions or concerns from school board members? If not, we can bring this meeting to an end. And thank you so much for sharing, like I said, the information. I'm sure the staff as well as the community appreciates it. So thank you.
Thanks, everybody. And we will see you Thursday and give you some more information.
Sounds good. Have a good night, all.